You're planning on getting a penile prosthesis, already had your consultation with your surgeon, and now you find yourself wondering, what are you to expect the day of surgery? Let's talk about it. Hello everyone, my name is Jonathan Clavell. I am a urologist surgeon and penile implant expert. I first need to clarify that what I will provide in this video will not necessarily be guaranteed to happen for your specific situation. Things might be different, or the order of events may be different depending on where you will be having your surgery done and who is your surgeon. So this video pertains mostly to men who are having the surgery done with me in Houston, Texas. However, some of the things that I will discuss today will likely be very similar for other institutions and other surgeons. It is important to understand that things may change with time, and this video was recorded in 2024. Things may change in the future. That said, let's start. Prior to the day of surgery, it is of utmost importance that you verify the date and time of arrival to the hospital or surgery center with your surgeon scheduler. Do not assume anything. Make sure you confirm the dates and time with the scheduler. It is likely that no one knows the schedule better than the surgery scheduler. It is also very important to know that the specific time of arrival will very likely not be provided until the day before your surgery. I will repeat that again. The time of arrival to the surgery center will be provided to you probably the day before your surgery date. Wonder why? Surgery schedules are very fluid and variable. There may be last-minute cancellations, emergency cases that may be added, delays for medical reasons, problems with staffing in the surgery center, among other things. And all of these things can affect the time of the surgery. For example, if you were scheduled to be the third case and the first case ended up being canceled for some reason, your surgery time will likely be moved up. So try to be patient if your surgery day is coming up and the surgery scheduler has not provided you with the specific time of arrival. Someone will contact you and tell you when to arrive. In general, time of arrival is 2 hours prior to the surgery time. That said, make sure your phone is turned on that day and that you check your email regularly. If you do not have a means of communication, it will be impossible for us to communicate with you. Now to the day of your surgery. When you wake up in the morning, we recommend you to shower with the Hibiclens soap one last time before you start driving to the hospital or surgery center. Make sure to wear comfortable clothes as well. When you arrive to the surgery center or hospital, you will go to the admissions or registration front office and tell them that you are having surgery. They might ask you who is your surgeon, tell them. While at the registration desk, they will also verify that all the finances have been taken care of and make sure that all the paperwork is ready. After they register you, they will take you to the pre-operative holding area. There will likely be another front desk there. You will tell them that you are having surgery, today. They will again ask for your name and who is your surgeon. They will verify this and take you to a room for you specifically. If you came to the surgery center with someone, if you so desire, that person may stay with you while you are in the day surgery area. If you don't want them there, just let the front desk know. Once you arrive to your room, the nurses will likely ask you to remove everything you have on and put on the hospital gown. This includes all of your clothes, underwear, any piercings, accessories, dentures, etc. Just basically take everything off and get the gown on and lay in the bed in that room. Then a nurse will come in and check your vital signs. That is, check your temperature, pulse, oxygenation, and blood pressure. If you're diabetic, they will check your blood sugar. They will likely ask about your medical history and what medications you take. I recommend you to come in with a list of your medications and the dosages for these medications, as this is important information that we will need. You don't need to bring all the bottles with the medications on them, just the list might be okay. They might also ask you if you have a pharmacy of preference in case any additional medications will be prescribed to you. The nurses basically want to make sure that everything is okay with your health and that nothing will interfere with your surgery. If one of the labs that you took prior to the surgery was abnormal and might affect the procedure or anesthesia, they might repeat that specific lab, but this is rare and unlikely to happen. The hospital nurse will then place an intravenous line in order to start the IV antibiotics. The anesthesia doctor or anesthesiologist will then come in, introduce themselves, and ask you several questions about your health condition. They will also ask you about the list of medications, if you have had anesthesia before, and if you had problems with anesthesia in the past. Any anesthesia-related comments or questions that you might have can be addressed at that time. If everything is good, then the operating room staff will come in and introduce themselves. That team consists of the operating room nurse, the nurse anesthetist, and maybe 1 or 2 surgical assistants. They will be the ones who will be helping the surgeon inside the operating room to ensure that the surgery will run smoothly. The questions they ask may be repetitive, and you might find yourself answering the same questions over and over again. But remember this, everyone who will be involved with your care needs to make sure that we are not missing anything. At some point prior to going into the operating room, the surgeon will also come in and talk to you. That would be me. I will ask if you have any specific questions prior to proceeding with your surgery. Feel free to address whatever concerns you have with me. It is unlikely that your surgeon, however, will be able to spend a long time with you here. Believe it or not, there are a lot of things that happen and things that need to get done behind the scenes to make sure that your surgery and everybody else's surgeries go smooth. So do not get frustrated if your surgeon only spent a few minutes with you. If you have a lot of questions for your surgeon, make sure you ask these prior to the day of surgery during your consultation. Important to remember, your surgery time may change. If your surgery was scheduled for 9 a.m. and it is now 9:30 a.m. and they still haven't rolled you into the surgery suite, try not to get anxious. When it comes to surgery, unexpected things and emergencies can always happen. Surgeries can get delayed for many reasons, so try not to get anxious. Your surgeon will get to you as soon as they possibly can. When we get close to your surgery time, the nurses will likely ask you to go empty your bladder. This way, your bladder will not be full during your surgery and we can potentially get away without placing a catheter. The nurse anesthetist and operating room nurse will then ask you to say goodbye to your loved one, and your loved ones will then be escorted to the waiting area. The nurse anesthetist will likely give you a medication through your IV that will help you relax, and off we go to your surgery. You will be rolled into the operating room, they will ask you to move into the surgery bed, and then the anesthesia team will induce the anesthesia. The surgery team will then put you in position, prep you for your surgery, and the surgery will be performed. What happens after surgery? After the surgery is done, anesthesia will be reversed. You will wake up and you will be taken to the recovery room, or PACU, which stands for Post-Anesthesia Care Unit. While you are here, another nurse will be attending to all of your needs and make sure that your vitals stay within a normal range. If you have pain, you may ask for pain medications, and these will be provided. You will be drowsy. You can sometimes even get nauseous. If you are, they will give you medications to help with that. After you are fully awake, you will be transferred to the hospital floor. If you're being admitted for observation, or more likely for my patients, back to the day surgery area, and here you will be reunited with your companion, and you can change back to your regular clothes, and then we wait for you to urinate before you are able to be discharged home or back to your hotel if you're coming from out of town. What happens if I cannot urinate right after surgery? After surgery, we need to make sure you are urinating well. It is not necessary for you to completely empty your bladder, but it is important that you at least have a decent stream. A few drops or a trickle is not enough. Why is that? In some occasions, when your bladder gets super full, it creates so much pressure that the muscle around your bladder is not strong enough to squeeze all that urine out. Imagine you are used to lifting a 20-pound dumbbell and all of a sudden we give you a 100-pound dumbbell. You won't be able to lift it. Sometimes after anesthesia, be it general or spinal anesthesia, some patients are not able to urinate, and the way to prevent future bladder complications is to empty your bladder so it gets to work properly. Drinking more water will not necessarily help you. If you feel the urge or pressure in your bladder and you are not able to go, tell your nurse. We can perform a bladder scan and see if you are too full. And if too full, we can either catheterize you or insert a catheter to stay overnight. Most of the time, that intermittent or in and out catheterization is enough and you will be okay after that. This is rarely needed, but do not worry if this needs to be done. This will not affect the result of your surgery. The important thing is that you don't go home if you are not urinating, because it will not get better on its own and it might actually get worse. Once I get discharged from the surgery center, what should I expect? The day of surgery, you will be tired and you will likely feel drowsy. If you feel you need to rest, rest. While awake, try to sit in a chair and walk around. If you have discomfort, it is wise to apply ice on top of the dressings. Ice helps with inflammation. At the end of the day, I would recommend you to see our video that talks about what to expect after surgery. Link above. because now that you have been through surgery, this video will make a lot more sense to you. In summary, as you saw in this video, there are a lot of moving parts and things that need to get done in order to ensure that your surgery will be performed in a safe and efficient manner. You should see the day of your surgery as day of surgery. Try not to have other plans that day. We want you to focus on your surgery and your surgery only. Even though a little anxiety is normal, try not to get overly anxious. Remember to trust your surgeon, and we are hopeful that they have your best interest in mind. We wish you the best in your upcoming surgery. Still have questions about this process? Feel free to ask in the comments below. If they pertain to your specific surgery, we suggest you communicate with your specific surgeons. Remember to hit like and subscribe for more content in the future. Until next time.